I went to St. John's University here in Minnesota, and then went to medical school at the University of Minnesota. After medical school, ended up in Michigan, Grand Rapids, Michigan, doing a 4-year residency in OBGYN. Then moved here to Crosby in 2004 and have been practicing OBGYN here for the last 14 years. So I'm part of a group called MINCOG, which stands for Minnesota Center of Obstetrics and Gynecology. And the group consists of 3 obstetrician gynecologists, myself, my wife Rachel, Dr. Kramer, and then we have 2 nurse practitioners, Donna Claypool and Melissa Goebel. Urinary incontinence is a very common problem in our country. In fact, approximately 18 million women suffer from incontinence. The problem with incontinence, unfortunately, is it oftentimes goes unrecognized. And in fact, about 70% of women take about 5 or more years before they will present to a medical provider to seek help for their condition. But the good news is that there are many successful treatment options for women who are struggling with urinary incontinence, which from a quality of life standpoint can be really debilitating and embarrassing. And I think that's why for us as physicians and care providers, it's important for us to always ask the questions, are you struggling with incontinence? So it is common, as I had mentioned, and it's common throughout all age groups, although it does become more prevalent in women who are postmenopausal. And that is for a variety of reasons, lower estrogen levels, weaker tissue, but incontinence can also happen in young women who have not entered into menopause yet. Yeah, so there's several different types of urinary incontinence, but the 2 most common types are urinary urge incontinence and stress urinary incontinence. And then when women present with both of those, we call it mixed incontinence, and that's probably the most common presentation where women have both urge and stress incontinence. So just briefly to go through what that means. Urge incontinence means that a woman's bladder has, urge incontinence means that a woman's bladder has become overactive. It contracts when she doesn't want it to contract, and that ends up leading to extreme urgency, and sometimes so extreme that she doesn't have enough time to make it to the bathroom. It can also lead to increased frequency of urination throughout the day and increase urination at night. So it can wake them up several times at night, which can be bothersome for obvious reasons and lead to daytime fatigue. So in terms of urgency, there's many different treatment options that we can pursue. Most conservatively, we can first talk to them about dietary modification. So sometimes it's as easy as talking to them about certain beverages that they may be drinking, such as caffeinated beverages. That would be coffee, tea, soda with caffeine, and alcohol. So all of those drinks contain caffeine, which is a diuretic and causes your bladder to fill up more quickly and can worsen urge symptoms. Sometimes just recommending that they reduce or eliminate those things in their diet can help with their urge symptoms. We also work closely with physical therapy. They can help patients with certain behavioral techniques that can help them with their urge symptoms. Next, if those things haven't worked, we can implement certain medications that can help, and there's several medications on the market. Basically, the medications work by calming the bladder muscle down so that they aren't going to the bathroom so frequently, and so that they have less urgency and then less incontinence or elimination of their incontinence. Lastly, if they've tried several medications and that hasn't worked, there's still treatment options. And those involve procedures that are same day, low risk, and procedures that we do here at Crosby. So even if they've failed medications, there's still options for them. And the success with these procedures is very high, up to 80%. The other type of incontinence that we commonly see is stress urinary incontinence. So unlike urge incontinence, which is a problem primarily with the bladder, stress incontinence is a problem with support underneath the urethra, which is a tube from the bladder to the outside. And that lack of support causes the urethra to move too much, and that excessive movement causes spurts of urine with activities of stress. And so what I mean by that is So women who may like to exercise, if they're running, jumping, lifting weights, with laughing, coughing, sneezing, they'll notice urinary leakage, which often requires them to wear a pad. So just like urge incontinence, there's several treatment options available for these women, so they don't have to just deal with the problem and wear pads. Actually, about 90% of women who have urge and stress, that is how they manage their symptoms. They just figure, well, I heard that this is a common problem. I'm just getting older. This is what I have to do. But unfortunately, that's not the case. And fortunately, we have good treatment options. So treatment options for stress incontinence include, again, most conservatively, having them see a physical therapist. And that's really important because the physical therapist can teach them how to do strengthening exercises. Because it's a problem with support, it's important for them to strengthen the pelvic floor muscles, and that strengthening can lead to significant improvement in their stress incontinence. In fact, some studies have shown 80% reduction in their stress incontinence. We like to implement physical therapy because oftentimes women will say, you know, I've done Kegel exercises at home and it hasn't worked. But the problem is oftentimes they're not doing them correctly. So by seeing a physical therapist, they can be certain that they're doing the exercises correctly, and then they can do them on a daily basis at home. If they have done that though, and it still hasn't worked, we in Crosby here do a surgery called a Sling Procedure. And this surgery has been out since the mid-1990s. So it has long-term efficacy data, meaning that we've had a long history of proven safety in this procedure and efficacy. So about 90% of women will have elimination of their stress incontinence with this procedure. We would always be happy to see women who are struggling with this problem. I know it's an embarrassing problem, but we're always happy to see patients with this problem. We enjoy treating it because it is often successful and it can make a big difference in their lives and improve their quality of lives.